Welcome back to PT Time with Tim. I'm Dr. Tim, a licensed physical therapist. Today I'm going to teach you the best physical therapy exercises and stretches for knee pain in regards to knee arthritis, which is that age-related degeneration in the knee. But first, here's my medical disclaimer. Knee arthritis is that gradual progressive knee pain that we get from our normal degeneration in the knee. At some point in time, you probably had an x-ray of your knee taken where your doctor tells you, hey, you've got knee arthritis. Maybe your knee sounds like an old creaky door that kind of creaks or grinds, whenever you squat down or you kind of move it. So these exercises and stretches are for you. One thing to keep in mind before we do any kind of strengthening exercises when you have knee arthritis is that you can only go through the pain-free range in order to prevent further irritation of the joint. Our first strengthening exercise is a straight leg raise. So for this exercise, I'm lying on my back. I've bent my left knee up and I have my right leg completely straight with my toes pointing up. I'm going to hold my pelvis with my core tight. That way my back is flat against the table, so I'm not getting any kind of arch. So we're going to protect our spine here. And what I'm going to do is lift my right leg with my leg completely straight, so it's that knee is locked out. And I'm going to lift it up just next to my bent leg, so they're even right now. I'm going to pause there for a slight second and then lower back down, keeping my core tight the entire time. So I'm just lifting that straight leg raise up next to my other leg, pausing each time, and we'll do 3 sets of 10. Our next strengthening exercise is the side lying hip abduction. So I'm going to lie on my side with my bottom leg bent, my top leg is straight, my hips are square, and I have my foot pointing straight ahead. So I'm going to place my hand on my hip, and I'm going to lift this leg straight towards the ceiling with just slightly kind of a backward direction as well. So it's lifting up and back slightly. What that's going to do is it's going to isolate my outer hip muscles, my hip abductors. So I'm going to lift up and slightly back. My toes are pointed straight forward, pausing, and then back down. Now, people cheat this one all the time, and so as they get tired, they're going to roll the foot towards the ceiling, and they're going to lean their hip backward, and that's going to engage the hip flexors, which are the muscles on the front side of the hip. But we're not trying to strengthen those muscles. We need to strengthen the outer hip muscles. So again, make sure your foot's pointed straight ahead, and we're lifting that leg slightly up and back. So that will be 3 sets of 10. Our next stretch is a hip flexor and quad stretch. So I'm going to stretch the muscles on the front side of my thigh. In order to do that, I'm going to take a stretching strap that I have here with a loop at the end. You can use a dog leash, that works really well, or just a random strap or a piece of rope, something like that. You're going to take the loop, place it around your foot, lie on your belly. So I'm going to roll over to my belly. Keep my legs together so that I don't have a leg kind of kicking out to the side. We want to make sure we have proper alignment with the stretch. And then I'm going to start to pull up gently on the strap. And so I start to feel a good stretch. Yeah, I feel it right on the front side of my thigh. And so I'm going to hold that stretch for 30 seconds, and I'll do 3 repetitions. Our next strengthening exercise is a quadricep exercise, and your quadriceps are the muscles that are located in the front part of your thigh. These are really important muscles because they support the knee directly. So for this exercise, I've taken a loop band, a resistance band, a strong one at that, and I've placed it around the edge of my bench here, along with my foot inside the band. Now most people sit in like a dining room chair where they can place the band around the leg of the chair, so anything like this will work perfectly. I'm going to raise my foot up slightly off the floor, and then I'm going to kick forward until my knee gets to about 80 degrees of bend. So you can see that my foot is just slightly more than say like a 90-degree bend, which would be here. But either way, when you kick out, remember we want to find that pain-free range that we can perform this exercise. So if I have pain here, then I can go out a little bit further, and maybe I don't have pain here, so this is where I'll do it. Or if I have pain way out here, I'll back off just a little bit. So make sure you find that pain-free area. Either way, you're going to hold it for 30 seconds. So you're going to feel that slow kind of onset of quadricep burn, which is exactly what we want. and then you're going to relax. And we'll do that for 5 repetitions, 30 seconds each. Our next exercise is a seated hamstring curl. So your hamstrings are located in the back part of your thigh. And what I've done to set this exercise up is I've taken a long, stretchy resistance band. I've tied one leg around the leg of our piece of furniture here. You can also tie it around like the leg of your table. Then I've took the other part of it and made a loop out of it and put my foot through it. So I'm sitting up here. I'm going to slightly lift my foot up off the ground, and then I'm going to curl my foot underneath me. So I'm feeling the contraction of my hamstring muscles in the back part of my thigh. For this exercise, I'm going to do 3 sets of 10. Our next exercise is a standing mini squat. So what I've done here is I brought a chair from our dining room table. You all right? And so I'm going to stand next to the chair, and I'm just going to use that for a little bit of support. I have my feet shoulder width apart, and then I'm going to squat down. So I'm working on my hip hinge right now. I'm sitting my hips back. That's how I'm starting my squat. I'm sitting my hips back like I'm sitting into a chair. You'll notice that my knees are staying over top of my feet. What I'm not doing is bending my knees forward. So we don't want to bring your knees forward. This is really gonna aggravate your knees if you have knee arthritis and you're doing a squat like this. So what we're gonna do is take our hips back in that hip hinge, coming down to about a half squat position. Remember, this is just a mini squat. This is not a full squat. And then back up. Sitting your hips back, keeping your chest up, and standing back up. So we'll do this for 3 sets of 10 through that pain-free range of motion. So as you get stronger with these exercises, you can increase the progression by going from 3 sets of 10 to 3 sets of 15. You can increase the resistance of the resistance bands, or you can increase the total range of motion. So remember, we were stopping initially where you were having some pain, but now after getting stronger and you have more support of the knee joint, you may be able to increase that range of motion. Make sure you go check out my other knee exercise videos as you continue on your pathway to living a pain-free, active, and adventurous lifestyle. Thanks for stopping by PT Time with Tim, where we restore to explore.